period when we can't come together in person, it's such a great opportunity that we have to be spending some time together through Facebook and being able to just learn about some pro-life current events that are going on in our nation. So today we have some very special guests with us who will be helping us discuss the topic of COVID-19 and abortion. So let me introduce you to Dr. Christina Francis, who is the chairman of the board of the American Association of Pro-Life OBGYNs, or AAPLOG, and Abby Johnson, founder of And Then There Were None, and also a former clinical director of Planned Parenthood. So thank you both for joining us today. It's such an honor to be able to speak with you both again.
Of course.
Great to be here.
So now coronavirus has been a topic on everyone's mind, and it's affecting almost every facet in our nation and culture, it seems like, even including the issue of abortion. So in a time when our nation's coming together to save and preserve lives, the abortion industry seems to be fighting even harder for a quote unquote right to abortion. Over the past few weeks, we've even been seeing Planned Parenthoods across the country asking for donations for personal protective equipment that's desperately needed by healthcare providers who are actually saving lives of patients infected with coronavirus. We've seen abortion facilities that have been staying open and directly defying state orders to end all non-essential elective procedures. And we've even heard of a case of an abortionist who's exposed to coronavirus and continued to be performing abortions on women. So it's just amazing how pervasive this has been in the abortion industry. And that even at a time when the entire nation is coming together to try to save lives, we're still seeing that the abortion industry is fighting to have a right to end others' lives. So as members of the pro-life movement, it's important for all of us to stay informed on these current topics and events so that we can be a strong voice for the unborn and protect the lives of women most vulnerable vulnerable to the abortion industry. So thank you both for joining us to be able to talk about these topics in detail. So to start things off, Abby, would you be able to share a little bit more about how the abortion industry has been responding to the coronavirus outbreak?
Sure. So they've been, really sort of doubling down, saying that abortion is an essential healthcare service. Of course, there have been now quite a few states that have deemed abortion as a non-essential service. Governors have come out and have said that all procedures and surgeries that are non-essential must be stopped. Usually it's been for about a 30-day period. I live in Texas, where one of the states where our governor came forward and said if it's a non-essential service, surgery or procedure, it must be stopped for 30 days. He clarified that did mean abortion, both surgical and medication. This also happened in Louisiana, in Maryland, in Tennessee, and Kansas, and Ohio. Some of the states are complying. Some of the facilities are complying. They are complying in Texas. They are complying in some other states. They are not complying in Ohio. They are deliberately defying the order. In Texas, they are, of course, filing a lawsuit, which we expected, trying to get a restraining order against the governor and his executive order. Abortion uses surgical and medication abortion. Both procedures use non-sterile and sterile PPE. Medication abortion in particular uses quite a bit of personal protective equipment. They are doing transvaginal ultrasounds for these medication abortions. That's a standard, not necessarily just set by lawmakers in some states, but that's a standard that's set actually by the abortion industry itself. They require a transvaginal ultrasound be performed before the medication abortion takes place, before any abortion takes place. That requires non-sterile gloves. The medication abortion also requires a follow-up visit that's going to take non-sterile gloves as well. The other thing about medication abortion is that there is a failure rate. And the failure rate in the reliable data that we have shows that it can be as high as 20% severe complication rates. And in those cases, a surgical abortion must then be performed. And surgical abortion is going to use PPE. And if the surgical abortion cannot be performed in-house, then the woman's going to be sent to the emergency room, and she's going to be put in a bed in the emergency room. And that bed is possibly going to be needed for a patient who is suffering symptoms of COVID-19. So, their response, of course, is ridiculous. They are, trying to get funding from the stimulus package. They're Planned Parenthood's friends, Nancy Pelosi, among others, were trying to include $1 billion into the stimulus package for Planned Parenthood and the abortion industry. Planned Parenthood does not do anything to try to, they haven't done anything to fight the coronavirus. In fact, they're actually making it worse. I mean, we see in abortion facilities where they're packing 50, 60 clients in there a day. No such thing as social distancing, social isolation. Inside of the abortion industry, they're making it far worse.
Thank you. And Dr. Francis, do you have anything to add about the risks that abortion facilities are imposing on women by remaining open and continuing to perform these abortions?
Yes, well, I would echo everything that Abby just said. I mean, she's absolutely correct in what she's saying about the risk that this puts women at all of the time, really. I mean, the risks affiliated with abortion, but especially now when we're worried about COVID-19. One important thing I think to point out is that the abortion industry likes to claim over and over and over again that they are essential healthcare for women. And there's a couple problems with that. First of all, we know that more than 85% of OBGYNs do not perform abortions. And therefore, I mean, common sense would tell you that can't be a part of essential women's healthcare then, if more than 85% of women's healthcare providers do not perform abortions. I don't know of any other aspect of the practice of OBGYN, which I do each and every day, that is essential that 85% of us don't do. So that just goes to show you that this is not essential healthcare. It doesn't treat a disease process. Pregnancy is not a disease, and we know that it has a lot of harms for women. And so, first of all, it's not essential healthcare. Second of all, if we were to buy their argument that they are essential healthcare providers, then they should abide by the same standards that all healthcare providers are being asked to abide by. Mm-hmm. All of us are making sacrifices. I practice just in the hospital now, but my partners that are in the office have closed the office for all non-essential visits. So that means things like cancer screenings are being postponed right now, simply because we care about our patients. We don't want them coming into a medical office where they might be exposed to COVID. And we want them to stay home as much as possible. And so, cancer screenings are being postponed until when this kind of dies down and we can safely have patients be back in the office setting. And so, I would say to the abortion industry, if you are claiming to be healthcare, then you need to abide by the same rules that other healthcare facilities are abiding by. The other thing that Abby brought up is using this precious PPE that every hospital right now is really safeguarding. I mean, we have reports of hospitals in the hardest hit areas that are running out of this PPE. Even at my hospital, where we're still kind of ramping up, we're already putting practices into place to conserve that PPE. Other ambulatory surgery centers that have closed their doors during this time because they do outpatient elective surgeries, they are donating their PPE to hospitals that are on the front lines of this fighting COVID, and yet abortion facilities are not donating their supplies. In fact, they're asking for people to give them supplies. That is completely medically irresponsible right now. The other thing in my state of Indiana is our state Department of Health has asked physicians that are not currently working because maybe they just do elective surgeries or maybe they are recently retired to either come out of retirement or to come and volunteer their time or come and work in hospital settings where they can help with this fight. So that's something else that we should be seeing coming out of the abortion industry that we're not. Instead, they're suing state governments over these very common sense recommendations that have been put forward by state and the federal government as well. So And, as Abby said, women sitting, and I've heard reports and seen pictures as well of packed parking lots at abortion facilities, and all of these women being ushered immediately into the abortion facility, and that they're sharing space inside of that facility. Again, this is completely irresponsible. As healthcare providers, we need to be doing our utmost to protect our patients. And of course, as OBGYNs, we have 2 patients. We have that unborn child that we're taking care of that absolutely needs to be protected. But we also care about our moms, our women that are coming to see us, and we need to do our best to protect them. And having them come in for a completely elective procedure that has no health benefits, only carries risks to the patient, especially during this time where we're practicing social distancing and really needing to be careful. It's just irresponsible for them to fight to continue to be able to do these at this time.
I couldn't agree more. And Abby, as someone who actually worked at a Planned Parenthood for 8 years, what's your response to seeing these reports of Planned Parenthoods and other abortion facilities that are asking for donations for PPE? I've seen that the Planned Parenthood in Keystone in Pennsylvania and other associated facilities in Pennsylvania have been asking for donations, and even in LA, the Planned Parenthood there has been asking for these donations.
I'm just not even sure why they would need them. They're not doing anything to fight against this virus. So it's not like all of a sudden their shelves are empty. I mean, it would only make sense if they were taking donations to then donate to the hospitals. But it's business as usual for them. They're not running out of any equipment. I mean, this is a quick money grab for them. That's all it is. It's a PR stunt. It's always about PR. It's always about money for them. It's always about attention. And it's absolutely ridiculous. I mean, and it just shows that they will literally use anything to gain attention, to garner attention, and to fundraise. And, what's been something that's interesting to me is, for years, Planned Parenthood has said, abortion, it's no big deal. It's like nothing. It's totally normal. It's no different than getting your, teeth cleaned or getting your tooth extracted. But now all of a sudden it's essential healthcare and everybody needs it. You can't take it away. Well, it's either going to be one or the other, right? It's either no big deal or it's vital, essential healthcare that people can't live without, right? So you can't have it both ways. But this is very, very, very typical of Planned Parenthood. I mean, look, they still have quotas to fill. They have abortion quotas that they have to fill. They still have those numbers that they have to meet. And unfortunately, during times of crisis, they will see an increased number of women coming in for abortions. They will prey upon the most vulnerable in our society. Right now, people are in a state of panic. They're scared. There's financial instability. And Planned Parenthood and the abortion industry, they're going to use all of that vulnerability, all of that fear to convince women to manipulate them into having abortions.
Yeah, speaking of this pressure and the quotas that a lot of these clinics are facing, in the past months, I've been seeing a real push towards chemical abortions, especially through telemedicine. And since this outbreak has begun, you've really been seeing the abortion industry pushing the need for telemedicine, getting chemical abortions into the hands of women. Abby, could you explain to us kind of the mentality that the abortion industry has with really pushing this form of abortion?
With the medication abortion?
So
Medication abortion is it's pretty simple for the abortion industry because in most states they don't have to have a doctor on site. Now, in some states like Texas, we do have laws in place where they have to have a doctor on site to actually administer the RU46, the abortion pill. But in the overwhelming majority of states, that's not the case. So the abortion pill is something that they see as a cost savings to them. Generally, for a first trimester abortion, the abortion industry is going to pay a physician $75 to commit that abortion. So they're saving $75 by not having to pay a physician to administer the pill. And because you don't have to have a physician there even for the follow-up, it's saving them money. And also there's just the time. They can do medication abortion any day of the week. Surgical abortion, you have to have a doctor there on site. With medication abortion, you can do that virtually any day of the week in states that don't require a physician. So it's just more money for them and a better opportunity for them to meet their quota, their abortion quota. And I'll just be clear, every single clinic in this country, every single abortion facility in this country has an abortion quota to meet. They don't have a quota for the amount of birth control they provide. They don't have a quota for the amount of adoption referrals. They don't have a quota for the amount of pap smears they provide, but they do all have a quota for the amount of abortions that are committed at their facilities. So medication abortion is, even now in some places, we see that there's a push for, being able to get pills through the mail, which is particularly frightful. You've got women now who are taking these pills at their homes, and they are laboring on their own, by themselves in their homes. They are delivering their babies in the toilet, and they are flushing their babies down the toilet alone, most of them with no support. And the abortion industry talks about, how we don't want women to have at-home abortions. That's exactly what a medication abortion is. And it's incredibly dangerous. It's more dangerous than a surgical abortion for the woman. Of course, abortion is unsafe for every single unborn child, but it carries greater risk than the surgical abortion for the woman. And, unfortunately, the abortion industry wants to see half of abortions being committed by medication abortion within the next few years.
Thank you for that. And Dr. Francis, could you provide us some of the medical details about the health risk involved with a medication abortion?
Absolutely. So we know that medication abortions carry, as Abby said, a significantly increased risk of complications when you compare them to surgical abortions. They have about 4 times the risk of complications in general. We know that somewhere between 5 and 6% of women who start a medication abortion will require a surgery to complete that abortion, whether it be because they don't completely pass the pregnancy, or whether it be that they don't pass anything at all. And some of those, a good proportion of those that require surgery will require emergent surgery. We also know that the medication that is used for medication abortions, RU486, causes an increased risk of hemorrhage and also causes an increased risk of infection. It actually actively suppresses the immune system. So it puts women at a greater risk of infection. It puts them at a greater risk of hemorrhage. That's always a dangerous thing for women, especially when they're doing these or completing them at least at home. And like Abby said, oftentimes they're alone because they might be ashamed of what they're doing or not want anyone to know what they're doing. And so they're oftentimes alone and they're going through this. So that's always a dangerous thing, but especially during this time of COVID, it's even more dangerous. We know that we have a blood shortage right now in this country because of decreased blood donations, because kids are home from school and things like that. So, now we're encouraging more medication abortions, or the abortion industry is encouraging more medication abortions, which means our hemorrhage rate is going to go up, and it's going to go up at exactly the same time that we have much less blood in this country. So again, not only are those unborn children going to be killed, but their mothers are going to be at risk of death as well. The other thing is that when we've got a global pandemic of a viral illness, that's not the time that you want to be immunosuppressed. And so taking a medication that actively suppresses the immune system theoretically could put you at a higher risk of contracting COVID and it being more serious if you do. The other thing is that, we're encouraging all of our patients right now with any sort of illness, that if it's something that can be managed at home, please just manage it at home, because we need to keep the emergency rooms open for all of the patients that are coming in with COVID. Well, if we're encouraging medication abortions, especially in more irresponsible ways, so women getting it through the mail, I've seen, unfortunately, I've seen medical organizations encouraging increased access to self-managed abortions. This is absolutely irresponsible. That means that not only are women not going to receive the appropriate counseling that they should be receiving, and the appropriate counseling about potential risks and things like that, but we also know that in the United States right now, the FDA has approved, unfortunately, the medication abortion up through 10 weeks of pregnancy. However, if someone's doing this from home, she might be 18 weeks pregnant and decide to go ahead and use this medication. Risks go up exponentially, actually starting after 7 weeks of pregnancy with medication abortion. And especially once you start getting into the second trimester, the risk of hemorrhage and the risk of needing an emergent surgery go up significantly. And so these women then are going to end up in the emergency rooms, where they need to be taken care of in emergency rooms that are already overburdened because of the COVID pandemic. So, these risks to women are very real risks that are already there, even outside of the COVID pandemic, but they're just exacerbated during this time because of the stretch on the healthcare system. So this is absolutely not the time to be encouraging women to do this from home, to be able to do it without a physician being involved. Again, I think we're all in agreement here that this should be stopped across the board because of the risk that it poses to women and certainly to their unborn children, but especially during this time. These should not be occurring, period, much less with fewer restrictions than already exist.
No, thank you for sharing that information. And this is just such vital information for everyone in the pro-life movement to know. They should be fighting to protect not only the unborn, but women who don't realize that there are so many risks involved, especially now with coronavirus, with having an abortion, be it a surgical or a medical or medication abortion. So thank you for all this information. And at this point, I really want to encourage everyone watching to reach out to their legislators, especially their governors at this time, and ask them to close the doors of the abortion industry right now. We need to protect these women, and we need to protect the unborn. And just having this background information makes the argument all the more ready and accessible to our legislators that it is in our nation's best interest to close the doors of the abortion industry. So we'll be providing in the comments information of how you can contact your governor to request that they close the doors of the abortion industry, that they stop non-essential abortion procedures. And you also can learn more and get more information by texting pro-life to 73075. And the information will be coming up on the screen in just a second. But please do contact your legislators and ask them to stop abortion in our nation right now.
And Claire,
so
can I add one more thing too that I think would be helpful as people are talking about this with friends or in the public square, or talking about it maybe with your local or state politicians. I want to make it very clear that this call for abortion facilities to cease and desist their operations right now, this will not negatively impact women who have life-threatening complications of their pregnancy. Mm-hmm. Those very rare instances where a pregnancy needs to be ended early via delivery because of a life-threatening complication to the mother, those are taken care of in hospital settings. They're not taken care of in outpatient centers, and I'm sure Abby can probably corroborate that from her experience. So this in no way is going to impact a physician's ability to save the life of a mother when that needs to happen. That can still be done in a way that honors the life of that unborn child, but also saves the life of the mother. So what we're asking state governors to do in demanding that abortion facilities cease and desist their operations, this is not going to lead to women dying because they can't have their lives taken care of when they face those rare life-threatening complications. So I just wanted to make sure that was clear, and that people know that as they're talking to their politicians and just talking to friends and those in their social circles.
Thank you for that. That's really good to know. So this time I'd like to open up this interview to all of our viewers right now. So if anyone has any questions for Dr. Francis or Abby, please send them in. Just write in the comments any questions that you have, and we'll try to get through as many as possible. So to start off, I guess we can maybe go into the details of the abortion clinic currently involved in the June Medical versus Rousseau Supreme Court case. Dr. Francis, I know that I saw you at the rally at the Supreme Court a few weeks ago. It's crazy to think that was only about 3 weeks ago. So could you tell us any updates right now on that case, and also just some of the background details of it?
Sure. So this case is based on a law that was passed. It was a bipartisan law that was passed in the state of Louisiana that just required, all it required was that abortion providers abide by the same standards that were already out there for other physicians that were doing surgeries at outpatient surgery facilities. So it required that they have admitting privileges at a local hospital, so that if they were to experience, or if their patients were to experience complications in the process of an abortion, that they could have a seamless transition of care from that outpatient facility to a hospital. I personally have taken care of patients in the emergency room who presented via EMS or via their own private vehicle, suffering complications of an abortion, and they showed up with no communication from the abortion provider whatsoever. And you know, you're working blindly, and you're just going off of what the patient told you, which sometimes is good, and sometimes, you know, they may not know, or they may be kind of covering things up just because they're embarrassed or they're scared. And so you really, as the physician taking care of them, are working blindly. So this law was aimed at preventing that. Either, you know, that physician who was doing the abortion could take the patient from the abortion facility to the hospital and take care of them as appropriate, or at the very least communicate with another physician who's there to say, hey, this woman is coming, here's what's happened, and make that transition of care very seamless. The other safeguard that it put into place is that when you have to have admitting privileges as a physician, then it is monitored by that hospital where you have admitting privileges that you are a safe and competent physician who's board certified to do the procedures that you have admitting privileges for. We know that one of the plaintiffs in this case was using a radiologist and an ophthalmologist to do their abortions. This is medical malpractice. Those physicians have zero training in how to manage a pregnant uterus, how to instrument a pregnant uterus, which is fraught with risk. Those of us who are OBGYNs went through 4 years of specialty training in order to know exactly how to treat a pregnant uterus and how to manage any complications that might arise from procedures. So, you know, if those physicians had admitting privileges, that would have been caught, and they wouldn't be allowed to have admitting privileges for procedures that they have no training in how to do. So, so that's all this law was requiring. It wasn't stopping abortions. Of course, each one of us on this feed right now would be in favor of abortions being stopped, but that's not even what this law was doing. This law was just saying that if women are going to have abortions, they should have access to safe and competent care. And that wasn't happening in Louisiana, which is why Democrats and Republicans alike passed this law. And then, of course, the abortion providers sued over it, claiming that it would make it, that it would place an undue burden on them, that they would not be able to get admitting privileges. However, in talking to folks from the Louisiana Attorney General's office, 2 out of the 3 of them didn't even attempt to get admitting privileges. So it's not even like they tried and they were denied. So this went to the Supreme Court, and it's a very important thing for the Supreme Court to consider. You know, before Roe v. Wade, the argument for why abortion needed to be legalized was so that we could try to stop unsafe abortions. But I think this case does a really good job of proving that even in a country where abortion is legal, it doesn't mean that they're being done in a safe way, and women are not being treated with competent and compassionate care, and that's what this law is asking for. So at the American Association of Pro-Life OBGYNs, where I work, we joined with several other organizations in filing amicus briefs to the court stating why this case, or why this law was so important, the benefit of admitting privileges, the safety provisions that provides for women. So we are very definitely in support of it, and really hoping that the court will make the right decision to protect women in this case.
Thank you. So a question from Karen is there a risk for crisis pregnancy centers to be closing alongside abortion facilities? And how is there a differentiation between facilities that are providing abortions versus ones that are providing care to women, pregnant women in need?
So pregnancy centers, the ones that, there have been some pregnancy centers that have closed because they've been forced to close.
Mm-hmm.
The majority of pregnancy centers that I know of, that I work with, are still open. They don't typically use a lot of PPE. I just actually was called in today to talk with two very abortion determined women. They actually had appointments scheduled for abortions. And, one thing that's important for us to remember is, a lot of times we see things like this happen in various states, like the executive order that's taken place in Texas and other states. And we say, oh, yay, that's a wonderful pro-life victory. Now no abortions are going to happen.
Mm-hmm.
And that's not necessarily true. I mean, I was with women today who had abortions scheduled out of state. They are willing to have illegal abortions, some of them. And so that's why it's very important to remember that most pregnancy centers are still open. They are still seeing patients. They are still seeing clients. I talked to both of these women today. Both of these women ended up choosing life because of God's amazing power. They canceled their abortion appointments, and their babies' lives were spared. But we're not done with our work here just because some abortion facilities may be closed right now. Women who are that desperate will find ways to have an abortion, or they will self-abort at home. And so, our work is still very much needed right now, and pregnancy centers are working very, very hard. The ones that are being allowed to stay open. I mean, they're open because their phones are ringing off the hook right now. If abortion's not easily accessible in their town, they're calling the pregnancy centers. And so this can affect pregnancy centers in the same way. If they are, there are some pregnancy centers, for instance, who do maybe STD testing. If an executive order is in place in that state, this would prevent the pregnancy centers from being able to do STD testing in-house, because that would not be considered essential care. But most pregnancy centers are open for counseling. They're open for supply visits, handing out diapers, doing things like that. So in those situations, most centers are staying open, and they're not affected.
That's good to hear. And also to all of our viewers, if you're able to, please do donate to your local pregnancy resource center. They are in desperate need of donations now more than ever. Yeah.
Well, and I think Abby brings up a good point too, that when women are empowered with information, which they typically get a lot more of at pregnancy resource centers than they do at abortion clinics. Oftentimes when they're empowered with information and with resources to help support them, many of them will make a choice for life, to give their unborn child a chance at life. And so that's why I think that giving women this information, the information we've been talking about, the information that pregnancy resource centers are giving them, is so important. Women can be empowered through education and through being given information. And at the very least, if they're still going to make that choice to have an abortion, it should be an informed choice where they've been informed of all of the risks before they take that step. So the work that pregnancy resource centers are continuing to do, and I know friends of mine that help run PRCs are practicing good social distancing. They're spacing people out in the lobbies if there's more than one person in the lobby, and they're spacing their client appointments out. So they're doing it in a safe way.
That's good to know. So Sarah would like to know if abortion is ever medically necessary. And I'd like to add on to this, especially with so many women being scared during this coronavirus outbreak. Is there medical risk to being pregnant and potentially having coronavirus?
It's a great question, and it's a question that we're getting from a lot of patients, a lot of nurses that I work with that are pregnant, that are taking care of patients in the hospital that are concerned about that. The good news in a lot of the bad news that we have about COVID, the good news is that there is currently zero evidence of what we call vertical transmission, meaning that if a woman is pregnant and she becomes sick with COVID, that she could pass that on to her child in utero somehow. So there's zero evidence of that. We have, evidence out of China, of course, since it started there, that we've got the most data from there, that they looked at amniotic fluid and placentas and breast milk, and there was no evidence of the coronavirus in any of those bodily fluids. So that's a great thing, that there's no risk of vertical transmission. So women who are pregnant, who are worried about COVID and how that might impact their baby, the good news is you don't have to be worried about that. We have no evidence that that's an issue. Even in the first trimester, there's still no evidence of any sort of congenital anomalies or anything like that. So that's wonderful news. We do know that pregnant women who get sick with any sort of respiratory illness like influenza are going to be at a slightly increased risk of having more severe disease than if they weren't pregnant. However, if you look at how pregnant women fare compared to the other high-risk populations that we know about, so people over the age of 60 or smokers or people with other medical comorbidities, the pregnant women still, it appears to be, are faring better than those people. So the good news is that, again, you don't have to worry about this affecting your baby if you're pregnant. Certainly, if you're pregnant and you're having symptoms consistent with COVID, you definitely need to contact your healthcare provider and be evaluated. But again, these women can typically get through the illness just fine. In rare cases, when they're in their third trimester, kind of midway through the third trimester and beyond, if they're very sick, then delivery might become necessary just to give their lungs more room to be able to expand. But again, at that point, that's not an abortion. We're just doing an early delivery of a baby who can survive and do well outside of mom. So we'll give that vote of confidence to women out there who are nervous about this and being pregnant. And so again, that's wonderful news. As far as are abortions ever medically necessary, that's a really important question to address. So first of all, I think let's talk about definitions and what we're talking about when we say the word abortion. Abortion's only intent is to end the life of that developing human being. That's its only intent. That's the only thing an abortion accomplishes. And so when you talk about abortion in that way, is that ever medically necessary? Absolutely not. Now, as a practicing OBGYN, have I been in a situation where I had a woman who was maybe 20, 21 weeks pregnant, so just prior to when baby can survive outside of her, with a life-threatening complication related to her pregnancy? Yes, unfortunately I have. And those are really awful situations for everyone involved. They're awful for the parents, they're awful for the physician taking care of them, because we know in those situations, and again, they're rare, but we do know in those situations we might have to intervene and deliver her early so that her life can be preserved. Those of us who are pro-life in all circumstances. That means we're pro-life of the baby, and we are absolutely pro-life of that mom. Mm-hmm. And in the rare situation where you can't save both of them, but you can only save one of them, then you absolutely have to intervene to save the one that you can. But again, that's not an abortion. Its intent is not to end the life of that developing human being. Its intent is to save the life of that mother. And that can be done in a way that honors the dignity of that unborn child. It doesn't That child does not have to be dismembered in order to save the life of the mom. That baby can be delivered intact so that the parents can appropriately grieve the loss of their child and to minimize the pain that that child will have to go through in the process.
Thank you for that. Well, as we close out this amazing lecture, and thank you both again for joining us, do you guys have any parting words of advice for everyone watching and for the pro-life movement at large?
Well, I would just like to encourage everyone. You know, we're still working, right? You know, people are sort of in a shelter in place, or they're on quarantine. But I posted on my Facebook today that you know, crisis pregnancy isn't on quarantine, and evil never rests, and abortions are still taking place. I mean, we're living in a very crazy time in society where we are not allowed to gather in houses of worship, but people are allowed to go and kill their babies in abortion facilities. And we need to continue to pray. We need to pray for the end to abortion. We need to be of service to pregnancy centers, to those who are actively on the front lines, who are doing everything that they can to not just make abortion illegal, but to also make it unthinkable, to change our culture from one of death to life. To you know, please pray for our physicians and our nurses, our first responders who are on the line during this time, on the front lines. And of course, those who are affected by this virus, those who are pregnant and who are scared. I mean, I'm hearing from women every day who are fearful. They're fearful to deliver their babies. They're fearful to continue their pregnancies for just all of the unknowns, the uncertainties out there. And so this is really a time for us to step up in the pro-life movement. And it's a time for us to really hone in our training, our skills. You know, it's important for us to know how to best articulate our message, that we are giving a message of hope and grace and compassion and mercy, that we are giving a message of truth as well, but truth with grace. And, you know, their March for Life, Students for Life, many other places are just giving us so many opportunities for training right now. So utilize those opportunities for training so that we can really be apologists, the best apologists that we can be for the unborn and for their mothers. And I would say that we really, you know, right now everybody's sort of at home. They're on their computers a lot, and I would say that you know, everybody take a step back from the computer before you post. I think that we all have a zeal for the unborn and for their lives, and a zeal for justice. And sometimes our words can, and myself included, sometimes our words can come across as sharp or condemning. And people are watching us right now, and they're watching our responses. Everybody's online right now, and everybody's looking, and there's going to be a lot of people in crisis over the next few weeks. And so really take a lot of time to be in prayer, and really take time before you type up that response, before you hit send on your Twitter account. Really take some time and think, is this going to be honoring to God? Is this going to be the Bible that I want people to read? Is this going to show people the ambassador of Christ that I want them to see? But just stay encouraged, and you know, keep fighting the good fight, and please do utilize this time to spend a lot of time in prayer with our Lord.
Absolutely. I just would say, one of the things that has given me hope and joy in all of this is, as I've been watching the press conferences that occur on TV every day, even Governor Cuomo from the state of New York, who signed into law last year, probably the most permissive bill on abortion in this country, has been talking about the value of human life and how one human life is not more valuable than another human life, and how we all need to band together to protect those that are most vulnerable amongst us. And I love it. I love that we're having this conversation in this country right now, because it goes along so well with the message that all of us have been trying to get out there for so long, in that human life is valuable, it's precious, that we value these babies, we value their moms, and that each one of them is equal regardless of the way they were conceived, or the color of their skin, or their gender, or anything like that. Every human life is valuable. And I love that that's part of the national conversation right now. And so I think it's a great opportunity to, as Abby said, with grace and with love, help those that are maybe on the other side of this issue from us see that applies to this issue as well, that all human lives are valuable, and that our job is to protect those that are most vulnerable amongst us, which of course the unborn are the most vulnerable, but then, women that are finding themselves seemingly hopeless and scared follow closely behind them. And so it's our job to reach out to them. My other message would just be to the women out there that are feeling very scared and hearing lots of messages of fear, that be empowered by the facts. Know that there are resources that are out there. And I know that if they go to the March for Life website, or to Abby's website, or even to AAPLOG's website, you can find those resources that exist for you. So they are there. There are people that are happy and willing to help you. You just need to reach out to us. So that would be my message for women out there, that please don't be scared. The resources are out there. We want to be there to help you and to support you, and help you through this difficult time. And then my final message, I think as a physician, I have to say this, is to say, please take this seriously. Please stay home. Those of us who don't have the option of staying home need those of you who do to please stay at home. Our hospitals are starting to become very, very busy. And so please, if you're able to stay home, so that we can get through this hopefully as quickly as possible. And then hopefully this kind of conversation will be able to continue just without the threat of COVID.
Well, thank you to you both, Abby and Dr. Francis. This has just been so informative and such a great opportunity for all of us to learn a little bit more about the pro-life movement. We'll be hosting another one of these interviews on April 1st, again at 4 p.m. Eastern Time. We'll be speaking with Support After Abortion, which is, I would hope, close to Abby's heart as well. They were the organization listed at the end of Unplanned, and it is such a great opportunity to speak with another desperately needed ministry in the pro-life movement. So I hope everyone watching can join us on April 1st for that as well. And then thank you again to you both. I hope that you both stay healthy and well, and that everyone watching also can stay healthy and well during this time. So God bless.
You too. Thank you.
Bye-bye.
Bye-bye.